OSHA jurisdiction over public schools and other state and local government entities. Updated November 16, 2020. As states and their public school systems consider how to provide education to students during the ongoing coronavirus disease 2019 COVID-19 pandemic, they face the safety and health of their students and the potential occupational exposure of their teachers and other employees, including support staff and transportation providers, to the SARS-CoV-2 virus, the virus that causes COVID-19. In 24 states and the District of Columbia, local educational agencies (LEAs), such as public school districts, and other state and local government entities are not subject to federal regulation, inspection, or enforcement by the Occupational Safety and Health Administration (OSHA), or state regulation under the Occupational Safety and Health Act of 1970, OSH Act. LEAs in these states may be covered by OSHA-approved state occupational safety and health plans, state plans, or other state laws. OSH Act jurisdiction over state and local government employers. Section 3.5 of the OSH Act, 29 U.S.C. Section 652(5), defines employer for the purposes of federal jurisdiction of OSHA as follows. The term employer means a person engaged in a business affecting commerce who has employees, but does not include any state or political subdivision of a state. Therefore, state and local government entities, including LEAs, are not considered employers under the OSH Act and thus are not subject to OSHA's federal regulation, inspection, or enforcement. They may be covered by OSHA-approved state plans. Private schools are considered employers under the Act and are subject to federal OSHA jurisdiction, as are some charter schools, depending on their administrative structure and governance. OSHA state plans. Section 18 of the OSH Act, 29 U.S.C. Section 667, authorizes states to establish their own state plans and preempt federal OSHA standards and enforcement. OSHA must approve state plans if they are, at least as effective, as OSHA's standards and enforcement. In addition, state plans must provide coverage for state and local government entities as employers. OSHA may provide matching grants to states to cover up to 1/2 of their state plan operating costs. Currently, 21 states and Puerto Rico have OSHA-approved state plans that cover all employers in the state, including state and local government entities. 5 states and the U.S. Virgin Islands have state plans that cover only state and local government employers, including LEAs. OSHA estimates that state plans cover approximately 40% of workers in the United States. State plans may incorporate OSHA standards by reference or establish their own standards that meet the "at least as effective" test required for OSHA approval. OSHA can terminate state plans that fail to remain at least as effective as the federal system. Table 1. OSHA-approved state plans. States that do not have OSHA-approved state plans may have their own occupational safety and health laws that cover some or all state and local government entities, including LEAs. However, these laws are not required to be at least as effective as OSHA standards or enforcement, are not in any way regulated by OSHA or the federal government, and are not eligible for OSHA grants. Rationale. The exemption for state and local government entities was part of the original 1970 OSH Act. At the time, numerous states had their own occupational safety and health laws, and there was concern in Congress about having the federal government usurp these state authorities. Concerns about the OSH Act's lack of federal jurisdiction over state and local government employers were addressed by the Section 18 provisions requiring states with state plans to cover such employers and the use of federal grants as an incentive for states to establish their own plans and thus cover state and local government employers. OSHA and COVID-19. OSHA does not currently have any standards that directly address the airborne transmission of diseases such as COVID-19. However, OSHA does have existing standards that cover personal protective equipment, sanitation, and the recording and reporting of occupational injuries, illnesses, and deaths, which may be applicable to COVID-19. Legislation, including a provision in H.R. 6800, the HEROES Act, and H.R. 925, the revised HEROES Act, as passed by the House, has been introduced in the 116th Congress that would require OSHA to promulgate an Emergency Temporary Standard (ETS) to cover COVID-19. Under H.R. 6800 and H.R. 925, State plans would have to adopt the ETS or a comparable standard, and state and local government employers not covered by a state plan would be covered by the COVID-19 ETS. The General Duty Clause, provided in Section 5(a) 1 of the OSH Act 29 U.S.C. Section 654(a) 1, requires that each covered employer provide a workplace that is free from recognized hazards that are causing or are likely to cause death or serious physical harm to its employees. OSHA has also issued guidance on preventing COVID-19 in a variety of workplace settings. OSHA has not issued any specific guidance on preventing COVID-19 in schools. State plan actions to address COVID-19. 2 states, California and Virginia, have state standards as part of their OSHA-approved state plans that directly address COVID-19. Michigan has promulgated emergency rules under its state plan that directly address COVID-19. For specific information on the California and Virginia state standards and the Michigan emergency rules, see CRS Report R 46288, Occupational Safety and Health Administration, OSHA, Emergency Temporary Standards, ETS, and COVID-19, by Scott D. Shimandera. California. The California Division of Occupational Safety and Health, Cal-OSHA, under its state plan, promulgated its Aerosol Transmissible Disease (ATD) standard in 2009. The ATD standard covers most healthcare workers, including school nurses, and workers in laboratories, correctional facilities, homeless shelters, and drug treatment programs. Pursuant to Appendix A of the ATD standard and an announcement made in February 2020 by Cal-OSHA, SARS-CoV-2, as a novel pathogen, is classified as a disease or pathogen requiring airborne isolation. This classification subjects the virus to stricter control standards than diseases requiring only droplet precautions, such as seasonal influenza. Virginia. On July 15, 2020, the Virginia Safety and Health Codes Board adopted an ETS under Virginia's state plan, VOSH, to specifically protect employees from exposure to SARS-CoV-2. As an ETS, the VOSH standard expires either within 6 months of its effective date, upon expiration of the governor's state of emergency, when superseded by a permanent standard, or when repealed by the board, whichever comes first. The ETS can be extended only through the normal state rulemaking process. Unlike the Cal-OSHA ATD standard, the VOSH ETS applies to all covered employers in Virginia, regardless of industry. As part of a state plan, the VOSH ETS applies to state and local government entities, such as public schools, as employers. Michigan. On October 14, 2020, the director of the Michigan Department of Labor and Economic Opportunity, which operates Michigan's state occupational safety and health plan, promulgated emergency rules to address workplace exposure to COVID-19. Like the VOSH ETS, the Michigan emergency rules apply to all covered employers in the state, including state and local government entities such as LEAs. These rules went into immediate effect and will remain in effect for 6 months. In addition to rules that apply to all covered employers, the emergency rules include specific provisions that apply to the following industries: construction, manufacturing, retail, libraries, and museums, restaurants and bars, healthcare, in-home services such as house cleaning and repair, personal care services such as hairstyling and tattooing, public accommodations such as sports and entertainment venues, sports and exercise facilities, meat and poultry processing, and casinos. Legislation to cover state and local employers. In the 116th Congress, H.R. 1074, the Protecting America's Workers Act, would amend the OSH Act to cover state and local government entities as employers. Similar legislation was introduced in previous Congresses. For additional information, CRS Report R 46288, Occupational Safety and Health Administration, OSHA, Emergency Temporary Standards, ETS, and COVID-19, by Scott D. Shimandera. CRS Report R 46540, COVID-19 Liability, Tort, Workplace Safety, and Securities Law, by Kevin M. Lewis et al. Scott D. Shimandera, Analyst in Disability Policy.